Welcome our guest speaker today to hear our Florida eClub, Rotary eClub. My name is Karen Reimers. I'm the president of the Rotary eClub of Florida. And it's my great pleasure today to welcome our guest speaker, Hollingsworth, who's going to speak with us today about heart health for women. This is an immensely important topic for women especially, but of course for everyone. She'll talk about symptoms of heart disease in women. Heart disease has a large mental, physical, and emotional toll on society, of course, and on women in particular. Symptoms of heart disease in women are often different from those in men. And so today's talk will help us better understand heart health for women so we can all be better advocates for ourselves and for those we love. So without further ado, I'd like to welcome Hollingsworth.
Thank you very much, Karen, and thank you to Rotary. This is a great opportunity for me. I am the coordinator for Women Heart Support Group in the villages in Florida, and Women Heart is a national organization. It's one word, Women Heart, and what we try and do is educate and support women with heart disease. But today, since we might have some men on too, I want to just talk about heart disease itself also. First of all, heart disease is anything relating to the heart. Could be your valves, your muscles, your arteries, your veins, anything that has anything to do with the heart is called heart disease. The other thing, interesting thing about heart disease is you never get rid of it. You'll always have it for life. There's a couple of reasons that you have heart disease, some of the risks for heart disease. There's three of them that you can't do anything about, and that is your age, your gender, and your genetics. If your parents had heart disease, or your aunt, uncle, grandparents, it's likely you'll get it, which is how I got it, which I didn't even know about. So it's important for you to understand that. And also, if you do have heart disease, start looking at your children, your aunt, your siblings. They also might be in line for heart disease. And first of all, heart disease in men and women is different. Men, we call it explode. Theirs is more electrical. Women implode. Ours is more clogging of arteries. Our arteries and vessels and veins are a lot smaller than men's. Therefore, it gets clogged a lot. This clog is called plaque. And plaque is consistent of cholesterol, hormones, fatty lipids, and a lot of more stuff. They're realizing more and more about what's in these clogs. But if your body produces it, that's just all. That's what you've got. Some of the risk factors would be diabetes, weight gain, poor diet, poor exercise, smoking, excessive drinking. All of this, none of this is good for your body. Your body can't operate, function correctly without, with all that on there. So that's an important thing. What's happening in the heart is your arteries take blood out of the heart and push it through the body, say up into the head and all the way through the body. The veins bring the blood back up. They come through the lungs. And that's the most important part. That's where you're going to get oxygenated blood and nutrients. And then the veins put it right into the heart. So the heart is very happy at this point. It's got oxygen, it's got nutrients, it's got blood, good blood flow, and now it can push it all out to the body. And this cycle goes on and on. But if you've got a blockage, you're not getting enough blood flow into that heart. You're not getting enough oxygen. The heart is starting to starve. And when it's the muscles and get all hard, and that's what would cause a heart attack. Now, in men, their symptoms are going to be a lot like women in some parts, but mostly the men are going to have chest pressure. When you see in the movies, is men grab their chest and fall down. That's not what heart attacks are. Heart attacks are not so much pain as pressure. You're going to feel heaviness, so much heaviness and weight on your chest and fullness. It really does feel like an elephant sitting on your chest. And you're going to be exhausted. When you could walk up the stairs last week with no problem, now you can hardly get up 3 steps. And it's sudden, and you don't understand what's going on here. I didn't have this before. And some of the symptoms are, as soon as I sat down, I felt great. But as soon as I started walking again, boom, there it goes again. So it's so important for you to be your own health advocate, to understand these symptoms and recognize them for what they are. As long as you understand that if you are at risk for heart disease, really pay attention to these things. Men can also have pain down their arm. But now for a woman, her symptoms are so silent that it's almost unrecognizable. In fact, we didn't even recognize women having heart disease until the 1980s. They've always thought it was a man's disease. They didn't think women could have heart disease, but so they only researched men. They only tested men. They only created medication for men, not for women's bodies and that sort of thing. What happens with a woman's symptoms is you might get a stomach ache. Why? Well, the heart and the stomach are pretty close together. If your heart's in distress, it's going to hurt the stomach. You're going to have indigestion. You might vomit. You might have pain. And you go to the doctor or the hospital, and they're going to say you just have food poisoning, or you have acid reflux, or you have anxiety, because they're not recognizing that women have these different symptoms. So it's important that you know them. And so you can have that. You can have, of course, the chest pain, pressure, but then your jaw will start hurting. It's like, where is that coming from? It's a pain in the lower jaw mostly. Then you might get a center in the back, a sharp stabbing pain right in the center of your back, or it'll go down your arm or under your arm. That's where my second or third episode was my arm. It was like someone took a vice grip and grabbed me, and then it went away, and I couldn't figure it out. But when you start knowing these symptoms, you start looking for them. And it's not always just the left arm. People think, well, if your left arm hurts, it can happen on your right arm. You can also have swelling in your arm, your ankles, and your hands. So these are all signs to look for. And if they start adding up, start thinking about it. The other thing is heart attacks or heart issues aren't just so sudden that you're blindsided. You will have these symptoms up to years before your first heart attack, months before, weeks before. I always know when I'm having problems at least 2 weeks in advance, and I know that it's starting. I have blockages. I have 4 stents, and I've had 7 heart caths, and I block completely. So these are things that I know now about my body, and this is what I try and help these women, educate them, support them. The other thing about heart disease is it's so debilitating, so shocking, so you feel helpless. I mean, and you're sad and you're scared, and it's so hard for others to understand it unless they've been there, and that's why I try to get all these women together, because they need a support group, and men too. You all need a support group. And even after an episode, you should always go and get rehab, cardiac rehab, because that's going to give you back some of your confidence. It's going to give you back camaraderie, because you're going to be there with other people, and other people have had the same problem, and you realize you're not alone. This is something that's universal. In fact, in the United States, there's over 800,000 heart attacks every year. It's the #1 killer for women. #1, you can add all your cancers together. Heart disease will kill you before any of those others will. So, and in fact, 1 in 4 people will die of heart attacks. It's very important. It's also very important that doctors start realizing this, and they're slow on the uptake, I have to say. And medication is slow on the uptake, because they just a lot of them don't understand the symptoms. When a woman comes in with symptoms, they try and find anything and everything other than heart disease, because it's not presenting itself as heart disease. I have yet to have an EKG look anything but normal. It's always normal. I mean, so that's not indicative of a heart attack. You could still be having issues. Now, that'll go up and down when you've had AFib, or when the electrical currents. That's why they always do the EKG, because men always show on the EKG, because theirs is electrical. But a plumbing, all I can tell you is I feel weird. I feel different. Something's wrong. And I don't know what, but you've got to believe me. And it's so hard for doctors or ERs not to just send you home. And I can't tell you how many people have been sent home and then die of a heart attack. So it's very, very crucial that you become your health advocate. You become educated and you start listening and reading and studying on this, and you start getting to know your body. And when I said some of the things you can help is a healthy diet and exercise and all this yada yada. But if you're destined for it and it's in your genetics, even a healthy person can drop. And you know that because you see these marathon runners suddenly drop. So it has nothing to, well, it does have a lot to do with your overall health, but it's not always the case. So be ready, be prepared, get to know your history. And what's scaring me now is they're finding more and more young ladies coming in with heart attacks and heart victims. What it is stress. Look at our pandemic right now. People are stressed. They're at home. They're out of their norm. Nothing is right. You can't exercise like you used to. You can't go to the gym. You can't interact with people. Stress is causing a lot of issues right now that are very important. So my daughters, my granddaughters, I constantly am telling them about heart disease and what to look for and be careful. And mine started with stress. I had just moved. I got a new job. I just bought a new house. It was like, it piled up on me, and boom, So these are things that if things are really getting tight with you or stressful, calm down, stay alert, watch your body, be aware, and talk to others about it, because you need to validate it. Say, this is the way I'm feeling and I don't understand it, but I just want to make sure somebody else understands it. And if you do have any of these symptoms, please call 911. Do not hesitate. You'll get on the phone with the 911 lady and she'll tell you, what to do. Choose some aspirin, be calm, and she'll keep talking to you until the ambulance gets there. And then the EMTs will be able to assess right away by looking at you, by listening to your heart and your pulse and your EKG and doing all that. And they're already radioing to the doctor in the hospital. Okay, we got a situation here. This patient is this, and this, and this. We're bringing her right in. Now they've already got a bed waiting for you. So don't try and drive yourself. You're wasting a lot of precious time. And don't get your spouse or loved one to drive you. Don't get your neighbor to drive you, and don't drive yourself, because you could go into sudden cardiac arrest. Women can have none of these things I told you about men and women is black and white. They can go back and forth. I implode, but I don't have electrical. My heart rate and my muscles are great in my heart. It's all the veins coming in that are clogged. So there's a lot of aspects of it. That AFib is extremely, I'm so shocked. I'm watching the clock too. I'm so surprised how much AFib people are having, especially, well, here in the villages, our mean age is 65. And more people are finding AFib, and that's an irregular heartbeat. It's still okay, but your top AFib is when your atrials at the top, the two top chambers are not in sync with the bottom. They're doing the tango and the bottom's doing the waltz. It's just not working. Then you've got VFib, which is when the ventricles start going crazy and the atrials are okay. So this is just an irregular. Then you've got arrhythmia, which is a rapid heartbeat. And then brachycardia, which is a slow heartbeat. So these are all things that can be triggered by any one of those risk factors I said, but plus stress, depression, anxiety, all of that can trigger some of these symptoms. So it's important that you understand those also. So please call 911. Don't hesitate if you feel anything at all, because I think I've called them probably 7 times, 8 times, and I've only been transported maybe 5 times. So the other ones were, you're going to be okay, ma'am. It's all right. And do you know what a relief that is to have somebody tell me that? The other thing is, if you can't get to a hospital or not near one, fast enough that there's a fire station. Get to the fire station. They can transport you. They can take your pulse, your EKG. They can listen to your heart, and they can know also if we got a problem, and they will transport you. So don't hesitate to reach out to people who can help you and learn who can help you. Educate yourself and know where your hospital is, know the route and that sort of thing that you can get there. And please take your medicine. If the doctor says you need this, 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 and this, and you go, I don't like pills. I don't like taking medicine. And it's like, I'm sorry, but your body needs it to correct itself. So please take your medicine when they tell you to. Another thing is, do not be afraid to go to the hospital during COVID. I know a lot of people are avoiding going because they don't want to get the virus. Well, you got a choice, heart attack or virus, you know. I would please go to the hospital. When I was in there last time, they said, it's almost empty in here because nobody's coming in. You know, we've lost more people with heart attacks and strokes because they refused to come in. They were scared. Do not be afraid. Just do what you have to do. Be your own health advocate. So, okay. Is that my time? I don't know if it's my time or not, but
oh, thank you. It's such a powerful message, Holly. Oh, I'm sure, you know, we certainly have more time, and I have a few questions. Maybe Dr. O has some comments as well, but you know, it's very powerful to hear your story, and it sounds like you've learned a lot from your own personal experiences living with heart disease over the years. Yeah, is there anything else you wanted to add before we launch into some questions?
Womenheart.org is the organization that I went through. They trained. You fly out to Minneapolis and you go to Mayo Clinic out there and you train for an extensive, you know, like a 4-day, 4-night period of time to learn this. I didn't know anything about heart disease when I started. So I had my first episode, but then I joined the group. Find a support group around, or just go to womenheart.org. It's one word, Women Heart with W capitalized, H capitalized. And there's all kinds of links. You can be matched up with a sister match, which I'm also part of that group. And so other people, I can, like what we're doing right now, talking, I don't know where you all are in the world, but we can talk, we can communicate. And that's what a sister match does. They will link you up through the internet with someone who has the exact same problems you do. So you have someone to talk to. As much as your loved ones love you, they just sometimes don't get it. And it's so hard to tell them because your spouse might say, no, you're fine now. You're out of the hospital. You got a stent. You're okay now. You're not, because you're scared. You're still gun shy. So anyway, I'm very passionate about this subject. So I could go on and on. Usually my talks are an hour and a half. So I've condensed it. But yeah, if you have any questions, please, I don't know if you're going to put my information there, put my email, my phone number, anything. I want to help people who are having issues. Like I said, men can also get these stents. I just had a dear friend of mine had his 16th stent put in 2 days ago, 16 of them. And what they're doing is they're putting a stent inside of a stent. That's how bad he's clogging. So these things are out there, they're happening. So yeah, take care of yourself.
Yes, that is a powerful message, to take care of yourself. And it's easier said than done sometimes. I think you mentioned how there can be a mental health component sometimes that plays into these symptoms, you know, and, you know, and it's true that, you know, anxiety can generate a lot of symptoms like rapid heart rate or even chest pain when it might not actually be a heart attack. But the fact is, you don't know until you do the testing. You just don't know. So, yeah, often people feel embarrassed, or, you know, and it's true that some of the medical professionals may not, you know, take it as seriously as they should either when there's atypical symptoms involved for the presentation. So I think that's really good to remind people, you know, to be advocates. You know, you mentioned your experience in the cardiac rehab and how that was helpful, you know, in different ways, including, you know, getting some social support and helping with the isolation aspect. Can you talk a little bit more about that? Because some of our listeners may not be aware, you know, what that is, or, you know, what's involved with cardiac rehab.
Okay, it's so important. And, you know, it's a shame, but a lot of cardiologists don't tell you about it, don't recommend you go to rehab. But it's vitally important. Anyone who has been to rehab has praised it. They say it's the best thing I ever did. Because you can't just walk out of that hospital and go home and be back to normal. You're not normal anymore. So you need the confidence. So what you do in these, it's like 6 months, no, or 3 months. 3 months of cardiac rehab. You go in there and they put these leads on you, and then you get on the treadmill or the bicycle, and they're watching you and monitoring on their screen. You're in a small room in the hospital, and you exercise and work, and they're watching the heart, and you're in the hospital. So if anything happens, you're in good hands. You're going to be rushed right down to ER. But it's confidence building, you know. When you come out, you say, I don't know what I can and can't do. I don't know what I'm capable. I don't want to get hurt again. I don't want the pain to come back again. And I definitely don't want another heart attack or another stent. So what do I do? And you can't just sit at home alone wondering. You've got to go. And it's very powerful. And they also, so you'll have 30 minutes of cardio, and then you'll have 30 minutes of education. They'll start telling you how to live your life now. Now your life will be a little different. Make sure you take your medicine on time, and make sure you eat plenty of fruits and vegetables, and this is why. And it's very educational, because you come out of there completely shocked out of the hospital, because you had no idea this could happen to you. Never, you know. So cardio rehab, I really stress it. And like I said, also, if you've had any help or if something happened, medication or anything, a procedure done in the hospital, your cardiac rehab is already paid for under insurance, more than likely, because they encourage you to do that, the insurance companies, because they don't want you to have another one, because it's more expensive, you know, to put you in the operating room than it is to put you in a cardio room, you know, a rehab room. So that's why it's important. And I would stress to any doctor out there, please encourage your patients to go. In fact, order them to go for cardio rehab.
Oh, great. That's really helpful. Thank you, Holly.
Okay,
yeah,
well.
Dr. O, is there anything else you wanted to add, Holly or Dr. O? Do you have any questions or concerns?
Yep, that's all I've got.
Yes, I've been through this a lot with the family and friends. I've got someone here listening that's, we were just blood pressure cuffing and trying to get that blood pressure down today prior to you coming on. Listen to your body. That's one thing I've had with my doctors, is not believing my symptoms, not believing, listening to me, because I know my body. I've been living it all these years. And saying, oh, you're a hypochondriac, and then until you put me in an MRI machine or put me in a cuff, that you're not listening to me. And women especially know their bodies or listen to their bodies more than men do. But some people don't know what their body's telling them. I remember my mother-in-law, she had for 20 years ulcers. And then they went away after her husband died. And then she started having ulcers again, she said. And for a week, she went with the ulcers and with my husband and son, and they drove down from Tennessee with the ulcers. And I said, when she got here, I said, I don't think you're having ulcers. I want to take you to the hospital. And she said, no, I had ulcers for 20 years. I know what an ulcer is. And I said, and the medicines weren't working. And she says, I want to go get some stronger ones. And I said, no, we want to go to the hospital. And she says, no. I said, okay, I'll take you to a walk-in clinic. Well, I had to lie to her. I said, I'll take you to a walk-in clinic. And I drove her to the hospital, and she started screaming at me. You lied to me. I had to lie to her, and I don't like lying.
Yeah.
I had to take her in. She lied. She told them she had ulcers at the emergency room. So we sat there for 2 hours waiting to get in. They called me and said, calm down, Mrs. Olmstead, but your mother-in-law is having a heart attack. And I said, tell me something I didn't know.
Uh-huh.
So she didn't know what her body was telling her because of her history. So sometimes someone else might know better than you do what's going on with your body.
Yeah.
That other thing is smoking affects the veins and the heart.
Yeah.
And so with that, you have your genetics and your environment and your behaviors. And whether it's eating or exercise or what you put in your body like smoke and secondhand smoke. But AdventHealth right now in Central Florida, including Lake County, can access WholeMe, where you go and give sputum. And I just did it and I'm waiting for my results. It's a whole body test on hereditary. It's an HE program where they will test to see for free your cardiac history, family history.
Mm-hmm.
So right now you can go and find out what your cardiac history is health-wise, genetics.
Very good.
So it's called WholeMe, and you can call it AdventHealth and ask them if you can participate in that. And they're looking for over 9,000 people that want to participate in it. And I just did it last week.
Wow, very good. Yeah, when I was doing a lot of us are, some people get into genealogy. I was looking at my genealogy and I was surprised how many people throughout my genealogy tree had heart attacks, had heart issues. So it's rampant. So it is important to know that. How did you spell that WholeMe?
WHOLEME. And
okay.
The woman who's running it that worked on it with me is jasmine.jones@adventhealth.com. And she's running it, jasmine.jones@adventhealth.com. And she's the one that facilitated it for me. And I had done a similar genetic test already, but it had other categories besides heart health. With Ancestry, I did a DNA test and had already seen that I had it on both sides. But I wanted to see what else AdventHealth was looking at on the heart, specifically on the heart. Whereas this other test through Ancestry looked at other categories. And I've had cholesterol, triglycerides, and the other areas of lipids. I've been on the cholesterol medicine since I was 19. And so I'm very well aware of it.
Yeah.
But we have to look at all the things that affect us around us, the people that are in our house smoking, the people that are in cars around us smoking, things like that affect our body. And the foods we eat and the habits of our Southern heritage or whatever we have, that the Philly cheesesteaks we eat and everything else from our heritage.
Well, the other thing that's important to know that people of color and are more likely or have a more serious problem with heart disease because of their diet. And they their lack of exercise maybe, or their lifestyle. So it's very true. I don't know how many Asians have heart attacks, but with their good diets, maybe not very many, but I don't know. But it is true to look at your genetics and the people around you. It's very true.
And the salt intake, the oil intake, the type of oil. Whereas we don't do well, Europeans with soy, but Asians do with soy. They do better with soy products. We don't do better with soy products because of breast disease. And so it's genetically well disposed with soy products. So we all have different genetic predispositions, but it's very interesting how our bodies work.
And what else is good? And Karen, you might know more about this too, is medicine. It does not sleep. I was just reading some more articles about some new information they're coming up with about what's inside the plaques. And they say, we are shocked. They said, we had no idea that some of the things that are in that plaque buildup that we're just now discovering. So they're not sleeping. The medical industry is not sleeping. They are coming out with new medicines, new findings, and they're constantly. So stay on top of that sort of information also.
Yes, it's exciting to see things developing, certainly with drug development or other interventions. I think prevention is huge too with cardiovascular disease. As you pointed out, stress management is one of the more important and most difficult to implement ones in our modern society, right? In some ways, for people, and the pressure on people is a lot, is there. And I think the lack of social support for a lot of people in our society these days is playing a role too. Into, people are coping by whatever, using addictive substances, or it's tough, especially with the pandemic. So I think this is a very timely message, that people should be advocates for their own health, and pay attention to what their body is telling them, and find ways to connect with others to their recovery. I think even under the best of circumstances, dealing with having a heart attack or other serious illness is very hard and isolating experience. But during a pandemic, it's even worse, because it's harder to, get support and do things that help you feel better, and prevent future episodes. So, I'm so glad that you reminded us of these things today.
Good.
Especially on Valentine's Day, that was very appropriate.
Yes, that's true. Heart health, indeed. And so you mentioned some of the most important resources. Just to recap that now for our listeners, and we'll try and post that on our website as well. But the most important website that you would recommend is womenheart.org, right? Yes. For those who are dealing with cardiac illness in themselves or in a family member. That's the single most important website, with the list of other resources and ways to get involved.
Right.
And helpful
they
programs.
They have a lot of videos online, and they have a lot of reading material there at that site. So yeah, it's very educational.
Excellent. Yeah, well, we'll make sure we post a link to womenheart.org, and also your contact information, as you asked us to. Holly, thank you for being available to people. I'm quite sure that you'll find, and I'm sure you already have found, that many people share your experience or are looking for a way to connect with others who understand what it's like to go through something like this. Thanks again.
I appreciate you having me on.
Oh, it's such a pleasure. Is there anything else you'd like to share with us today before we wrap up?
Just spread the word. Get out there and help others. When you see some signs of some of the symptoms I told you about, help that person and educate them. Says, this might not just be acid reflux. Let's go in and see. My first episode, I thought it was acid reflux. I was chewing Tums like crazy. And a fellow EMT said, so how's that working for you? And it wasn't. So that's when I finally went in. But we are stubborn. Human beings are stubborn. And we don't want, and we're scared. We don't want to know some of the truths. So
it's threatening to think about having an illness. Sorry, go ahead.
Cognitive dissonance.
Cognitive dissonance. Yeah, well, it's very threatening to think you might be sick. Most people don't want to consider that, but I think you've shown, you can find tremendous resilience and hope in recovery as well. And there are others to share that journey with you along the way.
Wonderful. Well, Holly, if you'll email or text us your phone number and email that you want shared, we'll add it to the website. Thank you so much.
Okay. Thank you so much for having me. I appreciate it.
Thank you. Bye-bye.
Thanks again, Holly. Bye. All the best.
Bye.
Bye-bye.
Bye.
Bye.